Hi, it's Bill, the knee pain guru, and welcome to my channel. Today we are going to talk about why it's important to get the correct diagnosis for your knees, or to get a diagnosis for your knees. That's hugely important in terms of understanding what's going on with your knees, and I'm going to get to that in just a moment. If you have questions, this is live, at least the first recording of this is live. Type your questions in, and I'll be answering those in just a moment. Make sure to like the video, give it a thumbs up, subscribe to my channel, and if you turn on the notifications so you know of future videos that I will be sharing with you about different topics around knee pain. So let's get into it. Why it's important to get a diagnosis for your knees. First of all, don't be like me. That's first and foremost. You need to understand what's going on with your knee first. And I get it. I get the whole deal that you don't want to go to the doctors. It's an unneeded expense. However, and this is really important, in order to understand what you're dealing with your knee, it's important to get that diagnosis so you know how to deal with it. It's like you can't straighten up the living room until you turn on the lights. And it's very much what a diagnosis does for what's going on with your knee. You understand if in one instance something is broken or torn in your knee that's causing the pain, or you could be in a completely different situation where nothing is broken or torn in your knee, and the doctors can't give you an answer. Those are two significantly different situations and scenarios to deal with. We don't know that until you get the diagnosis. Now, from my own personal experience, I did that. I didn't go to the doctor. I injured my knee the first time skiing, face planted, and nearly passed out, nearly vomited, and I thought I would go on with life like normal. And the knee was locking up, and it was doing this kind of weird thing where it would give way, and I ignored it. I was 28 years old at the time and was like, okay, I've never had a joint injury like that before, and just sucked it up and kept pushing through. And what I realized, hindsight is 2020, is I partially tore the ligament the first time. And I subsequently dislocated my left knee another 3 times before I went to the doctor. Now, knowing what I know now, and this is nearly 20 years later, if I would have gotten the diagnosis after the initial injury, I probably could have avoided the ACL reconstructive surgery in my left knee. However, I was stubborn and I kept pushing my body, I kept pushing my leg, and the knee kept dislocating. So a total of 4 times, skiing, judo, volleyball, softball. Finally, when I threw the ball to first base and my knee popped that last time, I'm down on the ground screaming, wondering what is going on with my knee, swelling up, all sorts of issues. And then I finally go to the doctor, and I went to a really great doctor, Dr. John Ellis from the University of Louisville sports teams. He was able to diagnose my knee without an MRI. He did the test on it, but because I had shredded the ligament in my left knee, there was nothing my body was able to do to repair it. So ACL reconstruction, they took out 2 pieces of meniscus, and there's a whole nother story on the other side of that. But my point in the focus of this video is to emphasize the importance of getting a diagnosis. Like going on the internet and doing research, it's a good thing, but it can be overwhelming. It can confuse you. Understanding what's going on with your knee, going to a good, solid doctor that really knows what they're talking about, that can give you a diagnosis so you know how to move forward with what's going on with your knee. So that's what I wanted to share with today. Once again, if you got questions, I see a few people on the video here. If you have questions, type those in to the chat box. And yeah, if you like the video, like the information, give it a thumbs up. Like and subscribe to my channel, The Knee Pain Guru, and then turn on the notifications so you know of the next time I'll be going live. I'm doing these irregular. We're going to do them twice a week. Different topics that viewers type in, like the questions that they ask are going to be important to understand, to answer those questions. So we have somebody, Singh typed in, it's been around 4 months since my tibia operation, and now in the MRI it shows ACL sprain, but there is no pain in the knee, but still instability. Okay. Instability in the knee usually is a function of loose ligaments. Ligaments get stretched, and they can, think of it, ropes. They get stretched too much, or rubber bands, they get stretched too much. They get a little sloppy. And strengthening the muscles in the legs is a different animal than strengthening the tendons and ligaments and fascia in the joint. So it's important when you're doing any sort of exercises that you're fatiguing the muscles sufficiently so you start strengthening the joint itself. I have a book that I wrote specifically on that subject, so I can post a link to that book. Hold on a second. It's called Stop Your Knee Pain Now. But there is a definite significant difference between muscles and tendons, ligaments, and fascia. Muscles make your legs strong. The tendons, ligaments, and fascia are in your joint. Like if you look on a muscle anatomy chart, there are no muscles in the knee. Like in the knee joint itself, there are no muscles. There's only tendons, ligaments, and fascia. So if the joint is unstable, it's a function of the tendons, ligaments, and fascia. So thank you. That's a good question or a good topic to talk about. And if you have pain, like you had said, there's no pain. You had the ACL sprain. You had the 4 months since the operation. If you have pain and you're looking for a direction to go, you can head over to my website, thekneepainguru.com. I have a 7-day knee pain reduction challenge that will begin to introduce you to a different approach. It's all about creating comfort in the knee by getting the pressure off of the nerves. So you can check that out if you'd like. I'll wait a minute or so more, if there's any other questions that you have. And if not, then I will wrap this up. Okay. Well, this one's a short one today. Thank you so much for being here. Appreciate it, for your attention. Give the video a thumbs up, like and subscribe to my channel. Head over to or turn on notifications to know of future videos that I will be producing. New people just got on here. If you have questions, please put those in the comments section, and I will do my best to answer them. If you have pain, you're looking for a direction, someplace to start, head over to my website, thekneepainguru.com. Take my 7-day knee pain reduction challenge to get you started around a different approach. It's definitely not your conventional physical therapy or what your doctors would be directing you towards. However, it's a unique approach that I've developed over the past 20 years to help people get out of pain. Why am I having no pain in the ACL? Their nerves aren't being irritated. Pain is actually a very simple understanding of pain is very simple. It's nerve irritation. And once you get the pressure off of the nerves, the pain goes away. And the more the nerves are irritated, the more pain you feel. The more tense your body gets, the more pain you feel. The tenser your body gets, the more pain you feel. It's like this cycle. And that it creates this kind of this loop or this downward spiral that causes people to be in pain for a very long time, many times their entire life. And the conventional approach is numbing the pain so you don't feel it, which doesn't address the issue. It just kind of puts a Band-Aid on it. And as soon as the numbing effect goes away, then the pain is right back there. So many people find themselves stuck in that loop. So, okay, I'm going to scoot. Once again, like the video, subscribe to my channel, turn on notifications, and if you'd like, head over to my website and take this 7-day knee pain reduction challenge. Thank you so much, Bill Paravano, the knee pain guru. Appreciating you for being here, and have a wonderful day, wonderful rest of the week.